Another infrequent operation that I perform is called the gastric plication. This is a relatively new operation. It's still regarded in many ways as being experimental. What happens in a gastric plication is, instead of cutting the stomach and removing it as you do in a sleeve gastrectomy, in a plication you fold the stomach in on itself and stitch it in an inverted pattern. You end up with a stomach that looks from the outside very much like a sleeve gastrectomy, but you haven't actually cut anything. The advantage there obviously is that the risk of perforation and leak is much less than in a sleeve gastrectomy. Having said that, the risk of perforation is not zero. It can still happen, but it's much less. I tend to reserve this operation for patients who are that little bit older, or who have particularly high risk for surgery. Obviously, if you're a very high risk candidate with diabetes or heart disease, we may not want you to run the risk of having a leak, which could potentially be fatal. So an option is either the gastric band or the gastric plication. Having said that, as I say, it doesn't have a long track record. We don't know what the long-term results are, but the patients on whom I have performed it, who tend to be in the 70 plus age range, have had a good short-term weight loss result. So certainly it's an operation that I'd be happy to discuss with you, but we are performing it only in a very select group of patients, and certainly cannot provide you with any significant evidence of very long-term results. But for some people it may be an option as opposed to a gastric band. Feel free to come into the office and have a chat if you're interested.